Now, let's go through the different techniques you'll be using in this therapeutic self-massage. I'm going to use the alpha ball in my quadricep to describe these different techniques. I will give you both massage terminology as well as role model method terminology. I'm going to place the ball in my quadricep, and then I'm going to relax. As I relax my musculature, my leg, and relax my body, my leg will be heavy, and I'll feel the pressure of where the ball and the body meet. Here, I'm allowing time and gravity to drive the release. In massage terminology, we call this deep pressure. In rolling, we often call it sustained compression. As we go throughout this course, I will be using both terms to help describe what we're doing. So, sustained compression and deep pressure. The second technique is, in massage therapy terms, effleurage, and in rolling terms, stripping. In this technique, we move up and down in line with the fibers and in line with the pull of the myofascial structures. To do that, I'm going to use my opposite leg as a kickstand, and I'm just going to explore up and down my quadricep. And I can move quickly, which will be less deep. It will be a little bit more superficial. Or I can go slower, which will be a bit more intense, moving a little bit deeper. But in both variations, I'm going in line with the direction of the musculature. If I find a place of sensation, like a trigger point, maybe I decide to stop in that spot. And here, to facilitate relaxation, I can use neuromuscular techniques such as contract relax, or PNF, standing for proprioceptive neuromuscular facilitation. And these are neuromuscular principles that allow us to help the body relax. So it looks like this. I squeeze the quadricep. I hold that quadricep squeeze for about 7 to 10 seconds, contracting all of the muscle fibers. And then I slowly relax into the weight of the ball. After I relax all the way, I contract again. This time I may even feel more muscle fibers recruiting. I hold that contraction another 7 to 10 seconds. And then I slowly relax, allowing my weight to melt into the ball a little bit more, feeling the ball move a little bit deeper. And then I do it one more time, squeezing the quadricep, squeezing the muscle I want to relax, holding it, and then slowly releasing after 7 to 10 seconds all the way. Generally, we'll do this about 3 times, each time holding about 7 to 10 seconds with a complete relaxation in between, to progressively use neuromuscular principles to relax the musculature. The next technique, in therapeutic massage, we'll often call it active release technique or functional mobilization. This includes moving the joints above or below the area we're working to influence change in the tissues. In role model method, we call it pin and stretch. For the quadriceps, it's going to look like this. I'm going to bend the knee and I'll feel the muscle pull underneath the ball. The ball acts like a fulcrum, improving the glide and the slide of the tissues under the ball. When I begin, I might not be able to move through the full range of motion, but as I repeat, the muscles will start to slide better, helping me restore full movement in that joint and in the tissues. The next technique in therapeutic massage is called Petrissage. This is kneading the muscles. So we actually pick up the muscles from the bone, knead it or wring it, and then place it back down. It's a picking up and putting down of the musculature. This happens in stripping, and it also happens in the cross-friction techniques with rolling sometimes, but it's best described by what we call plowing. And by plowing, what we're trying to do is to pick up the musculature and move it and place it down somewhere new. Just like a snow plow that's trying to push the snow from where it is to somewhere new. In the quadricep, it looks like this. Oftentimes, the outside of the quad gets bound down to the IT band. So I'm going to start at the IT band. I'm going to push down and try to move the quadricep back on top of the thigh. Then I'll reset and I'll do it again. So plowing in rolling is often unidirectional. So we'll pick it up, pull it, place it back down, just like Petrissage in therapeutic massage. That concludes the fundamental therapeutic massage techniques and role model method techniques that we'll be using in this course. I do want to let you know that is only a few of the many techniques that can be used. There are other common massage techniques such as tapotement, which is or vibration, a shaking action, which we will not be covering in this therapeutic self-massage program. There are also some additional rolling techniques that we may use as we go through the program that are combination motions that incorporate all of those techniques I just described together, allowing us to pick up the tissues on multiple planes. And lastly, in this course, we will also be doing some range of motion or stretching. Oftentimes in therapeutic massage, the therapist will stretch your limbs to improve your overall range of motion, and we will also do that here.